You're live, Chairman.
We're live. Okay, fine. Ladies and gentlemen, we'll just wait a couple of minutes more till 6 p.m. and then we'll get the AGM going. Thank you. Well, welcome, ladies and gentlemen. It's 6 p.m. and I'm delighted for all of you who've been able to join this Wye Valley Trust annual general meeting, which is the opportunity for us to look back on the year just past and some of the absolutely fantastic things that have been going on at Wye Valley on behalf of all of the citizens of Herefordshire, as well as some of the challenges we've faced. My name is Russell Hardy. I'm the chairman. I'm delighted to be joined by non-exec and executive director colleagues, including Glenn Burley, who you'll hear from in a moment, Andrew Cottam, who has been my vice chair, Alan Dawson, Ellie Bulmer, Jeffrey Atuli, Lucy Flanagan, Frank Myers, Erica Herman, Sharon Hill, Jane Ives, Ian James, John Barnes, Kieran Lappin and Francis Martin. So welcome everyone. Sorry, there's a few more. I've missed some people off. How rude of me. We also have David Moby on the line, Katie Osmond, Andrew Parker and Grace Quantock. So that is the board of directors and we serve the citizens of Herefordshire to the best of our abilities. As I said, we're delighted to welcome you all this evening, whether you're a member of staff, a partner colleague, local dignitary, volunteers, patients, member of the family or residents of Herefordshire and beyond. We do appreciate the support you give Wye Valley Trust and your interest tonight in our annual general meeting. The meeting is being streamed onto YouTube, the wonderful world of digital technology. And if you want to watch it in the future, therefore you're able to. It's saved for posterity. You will all have been invited to submit some questions. I do have a couple at the end. If you haven't, for those of you watching on YouTube, you are able to put your questions to the board in the YouTube chat function, or you can email us using the contact details on our Wye Valley Trust website AGM page. So this, as I said, is the opportunity to expand on the year we've just had. But we need to get rid of some of the formal business first of all. So the minutes of the meeting held on the 22nd of September 2022. I will propose those. Could I ask Andrew Cottam to second those, please?
Yeah, I'm happy to second those.
Then can I ask the whole board of directors, if you're not happy to approve the minutes of that meeting held on the 22nd of September 2022 to raise a digital hand. I can't see any digital hands raised, so that means the board of directors have approved those minutes from last year's AGM. Thank you very much. So I now want to introduce the annual report for last year, including highlights. So Glenn, over to you.
Thank you, Chairman, and good evening, everyone. Sometimes this section of the annual general meeting can be a bit dry, certainly compared to the quality accounts and some of the staff celebrations we're doing later, and certainly the feature on our robot. But actually, there's quite a lot of really positive things to talk about. The annual report ends up being quite a big document. And if you want to go to our website, you can see it in full. And what I'm going to do is take you through a few highlights from that report, and make sure also in doing so that we touch on some of the key performance measures that we are accountable for as an organisation. So next slide, please. So just when we thought we'd kind of faced every challenge as an NHS, we've had another year that's probably raised a few additional ones. So this year we faced industrial action alongside actually what was a very big wave of COVID over the last Christmas and New Year period, and a really big flu impact on the organisation. So we've seen throughout the year higher levels of demand, record levels of demand, particularly for our urgent and emergency care, as well as some of the recovery work that we've been doing to ensure that we address the waiting times issues that were caused by the pandemic. So throughout that, our staff have been amazing. So despite all of those challenges, we will be reporting on some incredibly positive things and lots of improvement and innovation across the organisation. Next slide, please. So a rather busy slide with lots of numbers on it, so I won't read them all out to you, but if you add them all up, just from an acute hospital perspective, there's over 500,000 contacts per annum taking place. Add to that the very large numbers of patients that we see in a community setting, and as Chairman said, the support for the entire population of Herefordshire, but also Powys. So quite a lot of activity still, 11,000 patients seen in Powys by this organisation. So the big geography, the complexity of our services is reflected in some of those numbers, but there's many more services that we could add numbers to. And as I say, certainly from an urgent and emergency care perspective, record numbers of attendances and activity. Next slide, please. So I'm going to talk through some of the key performance indicators from an NHS perspective, and I think anyone who's followed the NHS in the media will be aware that it's been a challenging few years. So the constitutional standards that were set out a number of years ago have not been met across the NHS for quite a while now. And there's various reasons why that is the case. I'm going to talk about our own local performance on that. And we're starting with the 4-hour wait in A&E. And the thing I probably want to emphasise on this is this looks at the total time that an individual patient is in the department. It doesn't mean that patients are waiting for treatment necessarily, and indeed a lot of our patients start their treatment within the A&E setting, some of whom need to be admitted into the hospital, some of whom are discharged from A&E. And what you can see from the data there is that our trust is in the top quartile for patients being seen and treatment started within 60 minutes of arrival in the emergency department. But we're really proud that we've been able to deliver that alongside some really high increases in demand. Next slide, please. The two indicators here, firstly, look at the really important issue of ambulance handovers. And one of the concerns throughout last winter was that there were too many ambulances that were waiting outside A&E departments with patients on the back of them. And those patients were therefore not getting the care that they needed. But indeed, those ambulances were not able to be freed up to get to the next patient that they needed to see in the community. We have prioritised the handover of patients at our A&E, and what you see there is our best ambulance handover times that we've seen across the region, as you can see again in the upper quartile of organisations. And that's no easy feat, particularly as the number of ambulances that have arrived has increased dramatically, both within the system, but also ambulances coming to us from other parts of the NHS. One of the ways that we've delivered that has been through different ways of working, some of which is in the community in terms of admission avoidance, but there's a lot of innovation that's taken place within the hospital itself. Same-day emergency care is one of those that we're particularly proud of, and you can see on that chart the number of patients that now have same-day emergency care, i.e. they are not admitted into the hospital unnecessarily. They have their assessment and their treatment, they go home the same day, is around 40% of our emergency admissions. If you went back a few years, that would have been a very small number. So those patients are getting really prompt care. They're not being unnecessarily admitted to hospital, which is particularly important for our frail older patients who can suffer more by staying too long in hospital. We get them home, we treat them on the day, and it's been great to see that level of what we call SDEC activity going on in the organisation. Next slide, please. So we're turning now to cancer care, and this has a number of indicators within it, and we're starting to concentrate on two main indicators, and I'll tell you which those are in a moment. But one of the historical indicators of demand has been the 2-week wait. So these are patients who are referred to us on a suspected cancer pathway by their GP, need to be seen within 2 weeks of that referral. There's a 93% target across the NHS, but I'd like to emphasise one of the issues sadly associated with COVID is a number of patients did not present during the prime COVID years, and therefore we've seen increasing demand since then. So a 25% increase above the 2019-20 levels that we've experienced this year, 19-20 being the baseline year prior to COVID. So that's quite a big increase in demand, and these are obviously services that need to be delivered very promptly. So we're really pleased that for 91% of our patients, they were seen within that 2-week window. The two indicators, though, that we're now starting to concentrate more on as an NHS. So firstly, this one, which is the 28-day referral to diagnosis. So these are patients who have been referred through that pathway, and therefore we're counting that 2-week wait, but then we're ensuring within 28 days of that referral, they have a diagnosis. So this is really important for patients. Hopefully for many, that diagnosis is that they do not have cancer, but for those who do, getting that diagnosis as quickly as we possibly can, and for those who don't, taking the worry of that possible diagnosis away as early as we can. So the trust is about middle ranking on that, 86 out of 142 trusts. 73% of people referred in March had their diagnosis within 28 days, and that was an improving picture over the course of the year and continues to improve. Next slide, please. The other of the two indicators that will start to be the main focus of cancer performance across the NHS is this second one, which is that treatment will start within 62 days of referral. So again, this captures those patients referred by their GP, and this is their first definitive treatment needing to start. That might be a surgical intervention, it might be a medical intervention, it could be chemotherapy, radiotherapy. And ensuring that starts within 62 days. There's a 85% standard in the Constitution. This is one of the areas where the NHS has slipped back because of the issues related to COVID. So for us, we achieved 65.4% of that, 545 patients of the 833 being seen within 62 days. But as you can also see from the chart at the bottom, that's been an improving picture throughout the course of the year and continues to be a significant area of focus. And indeed, when we look at our surgical robot later, I'm sure we'll make reference to how that will help us to improve these targets further. Next slide, please. So referral to treatment time. So these are our elective patients. So patients not with cancer, but patients who need an operation. Some of the biggest volume areas being areas like orthopedic and ophthalmology. Again, a significant hit on this target during the years of COVID. And this has been one of the main focuses of the NHS over the last years to get ourselves back to a position where we've seriously reduced those backlogs. And what you can see on that chart is the number of patients who are waiting over 78 weeks. The NHS set itself a milestone of getting to the end of the year not having any patients 78 weeks, and as you can see, other than a very small number, we achieved that. So we're really pleased with that level of performance, particularly bearing in mind the historical waiting times issues that we had as a system, so huge amount of work from all of our teams to ensure both the admitted and the non-admitted pathways have been achieved. And also a bit of a nod to our colleagues in Foundation Group who have, we've been putting up arrangements of mutual aid. Valley's been offering mutual aid to other organisations also. And so this has been a real coordinated effort within the NHS, but probably even more coordinated within our Foundation Group to ensure that our patients are receiving the very best care as quickly as they possibly can. And then the final indicator on that chart is the time to a diagnostic test. The idea being that that should be less than 6 weeks. And again, you can see over the course of the year, a significant improvement in that. And we'll talk a little bit more about our future plans for diagnostics later. Next slide, please. So another really important indicator, obviously, is the level of mortality for patients who are treated by the organisation, and this picks up their time in the hospital, but also the 28 days from discharge. And what the NHS does with this indicator is standardises it, looks at the case mix of patients, and looks at what ought to be the level of expected mortality in those groups. And we're pleased to see here that we've moved to a position where we're around the average for the NHS, from a position where we had some challenges a few years ago, and we focused on those and we've improved our overall position. We also celebrated earlier today the success of our pathology function, that we've been the first site in the West Midlands to implement the advanced digital pathology technology. And that's really important for us in Herefordshire because it's a challenging area to recruit staff into. So digital pathology allows us to use capacity elsewhere in the NHS to ensure that we report our results as quickly as possible. We've moved from a situation where a histopathology slide had to be taken and analysed in the lab to being able to take a really high quality digital image of that and therefore be able to report that from any setting in the world. Next slide, please. Our staff are our most important colleagues, and they help us to deliver all of those things that I've already talked about within the annual report. We're delighted to be able to report that we have seen further improvements in our NHS staff survey. So we're actually scoring above the national average in all of the 9 areas that make up the main areas within the staff survey. So that's a really good result, and there's some areas that feature particularly highly within that. Our focus has always been about enabling our staff to achieve their absolute potential. And so huge thanks to the leaders within the organisation that bring that about and have created a culture which supports and encourages staff to thrive. And that's also been part of our approach to health and wellbeing. We've been working with the local leisure service provider Halo. We've been providing fitness sessions, and then also we've been doing some innovative work with University of Derby, looking at a nature connection programme for our staff. So lots of things going on with staff. And in fact, earlier today at our board meeting, we saw some of the impact of that, which despite the challenges that the whole NHS is facing, we have seen improvements in recruitment and retention, reductions in sickness levels, and a reduction in agency staff, which obviously has a financial benefit, but also a huge quality benefit. Next slide, please. Thank you. So we continue to look at how we can improve the experience and arrangements and support and opportunities for our staff, and there's a few things listed here. Firstly, we've created a new arrangement where our healthcare support workers, who are really key members of the team, can progress, and that's helped us to recruit and retain more, moving from a vacancy gap of 80 to under 10. But it's also created a situation where there are lots of routes within which individuals can progress within our organisation. And one thing I'd certainly like to encourage some of the younger people out there thinking about careers at the moment to look at a career in the NHS, look at a career in Wye Valley, because what we try to ensure is that everyone has the ability to go from any level to the highest level, potential level, supporting them with training and supporting them with opportunities. Our international nurse recruitment is also incredibly encouraging here. This isn't just about filling gaps in the workforce. This is about adding skills and diversity to our workforce and indeed to the local community. So some great examples of how we've brought people from all over the world to help us to be the best we can possibly be in Herefordshire. Next slide, please. And again, lots of things going on with education and development. We've moved quite a few things to virtual sessions. And so here we talk about mandatory training. Microsoft Teams has brought, as we can see today, a way of connecting people over some distance, but also particularly for our community staff, it's made things much more accessible to them because they operate all over Herefordshire and Powys. So it's we've been able to offer training and e-learning for them in addition to lots of people who are hospital based. Basic learning support, refresher training, leadership and management development program, both for clinical and non-clinical staff, our clinical education fellows, and using digital technology to support some of our new staff. So lots of things that have contributed to that improvement that I described earlier. Next slide, please. So looking forward, there are some great developments taking shape. And one of those is the £21 million elective hub project, which is well underway, as you can see from the photograph there. So in addition to the recovery that I described earlier around elective work and cancer work, this new day case and cataract focused facility will give us even more capacity to deliver more into the future. So we'll be very much looking forward to that opening in May of next year. Work is well underway to do that, but not just to open more capacity, but to maximise the productivity and improvements that we can see through that. So there's a lot of work going on to maximise theatre productivity and to ensure that patients' experience is absolutely at the forefront of the way that we deliver care. Next slide, please. And then a couple of other things that are in motion at the moment. One is a community diagnostic centre. This is a national initiative to ensure that we firstly increase our diagnostic capacity as an NHS, but then secondly, to place that in locations that are accessible to the public, in addition to the capacity that we have on hospital sites. So we have the go-ahead and business case completed, and we are looking at an April 25 opening for that. There's also a state-of-the-art education centre project underway. In part, this is to support the really exciting development of a local medical school supporting 3 counties. So we'll start to see more medical students, but also during the course of this year, we saw the production of a workforce plan across the NHS where we're increasing other disciplines of staff. And we found ourselves a little bit constrained on site. So this education centre, which will not just be for us, it will be an asset that could be used by health and care and partners in the system with support of Herefordshire Council and other stakeholders. We're planning to open that late 2025. Next slide, please. And in addition to all of that, we actually have been leading on this. And one of the things that I'm really proud with around Wye Valley within the foundation group is Wye Valley has led on investing in our greener future. We have the ambition of being carbon neutral as an NHS in the not too distant future, but Wye Valley has certainly led the way on that. So we've already completed the first phase of this with ground source heat pumps that are in place and solar panels that are in place. We've got funding for the second phase, which is to put in an integrated energy centre in place. and then also to install 2 large air source heat pumps. So we will decarbonise our site, and at that point 95% fossil fuel free, which will certainly be leading the NHS on this, and our big moves within our strategy that we announced this year. That's one of the things we wanted to do to lead the NHS on carbon reduction. So well done to the Wye Valley team for doing that. Next slide, please. We don't deliver this alone. And one of the things that is really strong within the county of Herefordshire is the level of partnership working. And this isn't about individual organisations leading on this, it's about the collaboration of all parties. One Herefordshire partnership has been around for a little while now, so that we've been quite fortunate as we've moved into integrated care systems as an NHS, that in Herefordshire we were already in a really good place to do this. So the development of integrated care systems has allowed us to accelerate some of the things that we were already wanting to do, and has allowed us to focus on the place that is Herefordshire, and huge collaborative working with our GPs, with our social care colleagues, but also with volunteers across the patch. So there's lots of elements of this that we're incredibly proud of. The key objective for us as an NHS is to ensure that we work together with partners to look at the wider determinants of health, not just to forever look at the demand that comes through the front door of the hospital, but to think about how we can work together to reduce that and to give people better outcomes, and to invest in things that prevent ill health and give people healthy lives. So that partnership is what does that. And over the next few slides, if you can just take us through those, there are some words from our key partners, which I'll not read out the words, but it starts with Dr. Mike Hearn, Managing Director of the Hereford General Practice Group, and just to say now how impressed we've been with the way that GPs have got alongside us and helped us through this initiative. Primary care continues to be the area of the NHS that sees the most activity. So it's vital, but it's also vital that we connect, and the connection and the collaboration between our hospital and community service in primary care is second to none. Next slide, please. Then Hilary Hall, Corporate Director of Community Wellbeing for Herefordshire Council, says a few words about how we've been working together in partnership with them. Again, really key partners. And we also collaborate with our county council partners in back office functions to ensure that we're efficient as well as delivering integrated care. And the next slide, please. And then Sue Harris, Director of Strategy and Partnerships for Hereford and Worcester Health and Care NHS Trust, who support us particularly with mental health provision in the county. And again, they've been really key partners in all of this. And this isn't, as I've said, about any individual organisation being more important than another. It is about true partnership working and collaboration to deliver the best care for our patients. Next slide, please. And then finally, from me, we've had a busy year, and we're almost halfway through another busy year. And so what this slide sets out are a number of objectives that we've set out for the year. I won't go through them all. Over on the right-hand side there, that we went through a strategic refresh, which is common across the group, which has allowed us to collaborate across the group and ensure that we're sharing best practice at pace across the group. And we're also been delighted from the 1st of August that our colleagues at Worcestershire Acute Hospitals NHS Trust have joined the group also. So as you can see from the backdrop, we now have 4 really powerful organisations who can help us to move forward and share best practice and do the best for our local communities. So that's the end of what I wanted to take us through, Chairman.
That's fantastic. Thank you very much, Glenn. And as I think members of the public and friends who are joining the call or watching the YouTube stream later on in the day, an absolutely broad canvas of investments, activity and progress at Wye Valley. We're not getting everything right. We know if you've been waiting on occasion in ED that we still have real operational challenges because of the increase in demand. But I couldn't be prouder of all of our frontline teams and the work they do day in, day out in that regard. So we'll move on then to extracts from the annual accounts. And Katie, over to you.
Thank you, Chair, and good evening, colleagues. So this is an opportunity for me to share an overview of our finances and our annual accounts from 22-23. And just before we get into the detail, just to confirm the status of those, they are marked as final draft in terms of the documents available at the moment. We're just reaching the end of the formal external audit process. So we've held our final audit committee, we've reviewed the draft auditor report, and we're just now going through those final checks and balances between the trust team and the external auditor that will allow us to complete the formal sign-off process. So a largely administrative piece of work to conclude, but certainly the numbers presented here today are effectively final. So I'll just run colleagues through some financial headlines, the audit position and findings, and a look ahead to 23-24. Next slide, please. Thank you. So in terms of 22-23 outturn then, so we reported an adjusted financial deficit of £6.5 million. We had a plan to deliver a deficit of 6.6 million, so effectively we did what we set out to achieve. I think that in itself underestimates some of the challenges that we faced during the year and some of the complexity that we dealt with as an organisation, but very pleasing that we were able to deliver in line with what we'd set out to achieve in such a challenging year. In terms of our key financial duties that we're required to work towards, so we were in line with where we needed to be in terms of our capital resource limit and the cash limit that is associated with that. We spent £14.4 million on capital works, and we'll come on to that shortly. We also were able to continue to improve how quickly we paid our suppliers and the number and percentage of our invoices that we were able to clear within 30 days. And that's really important for some of our smaller, particularly local suppliers, that we enable them to maintain their cash flow as well. So it was certainly an improving picture and has continued to improve. In terms of our overall income and expenditure performance, so although we delivered what we set out to achieve in terms of plan, as measured against the national standard, which is a rolling 3-year break-even duty, we aren't currently achieving that. And as a result, the auditor will have to make a referral in line with standard practice. But it was still pleasing that we achieved what we set out to. Next slide, please. So in just painting a picture really for people in terms of where we get our money from and where we spend it. So the vast majority of our income comes from our local commissioners, NHS England, and from our colleagues in Wales. That by and large is the vast majority of the income that we receive. And unsurprisingly, where we then spend most of that is on our costs of our workforce to deliver activities to our patients and services to our population, and the clinical supplies and services that go alongside that and managing the estate. Next slide, please. In terms of our capital then, as I alluded to earlier, so we spent just over £14 million worth of capital resource across a number of key programmes. And typically in any year, our programme is a mixture of both replacement of medical equipment, building works, and digital programmes, etc. So the table and in the annual report itself just sets out some of those key programmes, and you'll hear about some of those through some of the rest of this forum tonight. We largely get funding for that investment through the funds that we generate internally from depreciating the assets that we've already got, from targeted national schemes, and through what's called public dividend capital, so effectively a national funding route to provide additional cash to allow us to invest in some of these assets. In terms of our cash position, so our cash balances remained really healthy throughout 22-23, which is a result of as we came out of the COVID period where nationally cash positions had been stabilised, and we were able to maintain that through the year. As I'll allude to shortly, we've got a planned deficit for 23-24 at a much higher level, and cash will increasingly become more challenging for us, so it is requiring some quite close management currently. Next slide, please. Thank you. So this just summarises the output and conclusion in terms of the formal external audit of our accounts, and I've reviewed this with our external auditor and they're comfortable with the content. So in terms of their conclusion, it's based on two areas: one, the financial statements themselves, and the other, a value for money assessment, which is a standard part of the national audit process. In terms of our financial statements and the accounts, so they do give a true and fair view of the financial position, so there are no material audit issues, and the auditor also has to review our annual report and compliance with reporting requirements, and they're satisfied that we meet those. In terms of delivery of the audit process, it has been a really challenging audit cycle this year, partly due to increased audit requirements, increased complexity in some of the financial audit arena, and also some workforce capacity challenges that we've had within the organisation, and that's come out through the auditor recommendations and are being taken on board moving forward. In terms of value for money and their assessment there, financial sustainability, we previously had a significant weakness flagged in that regard by the external auditor. It's been there for the last couple of years as part of the value for money work, and so it remains at the present time, but there are no further or new recommendations about things the organisation should be doing in that regard. Similarly, the auditor concluded there was no significant weakness in our arrangements around governance, and also in terms of overall approach to economy, efficiency and effectiveness. So broadly, a pleasing result from a value for money perspective. The quality account, which we will come on to shortly, used to be required to be reviewed and audited by the external auditor, but that has not been the case in 22-23. So it's just noting that the external auditor hasn't undertaken any work there. And the future considerations are really just about how we take on board some of the learning from this year's audit process in terms of implementing those recommendations and really making sure that we've got some robust audit planning and spend enough time as a team and with the auditor doing some interim work to ensure that that increasingly demanding accounts timetable can be managed more proactively. Next slide, please. And just as Russell's already commented, we're nearly halfway through 23-24, so it's a good opportunity just to do more of a forward look rather than a backward look to where we finished last year. So those that may have joined our public board meeting earlier will have heard where we're at to date in July, but our plan for the 23-24 financial year was a deficit of £22.3 million. We're broadly on plan year to date at month 4, but there are a significant number of challenges that we face as an organisation that will require close mitigation moving forward. A couple of those are set out here and are well rehearsed across a number of forums, so I didn't intend to repeat them today. And I have just listed some of the areas that make up, again, another significant capital investment programme in 23-24, and a number of those I know we've either touched on already in the annual report update or will come on to later in the agenda, so they're just listed for information. Finally, just to complete this section, I couldn't finish without saying a huge thank you to the whole of the finance team for all of their support in the audit process and concluding the accounts at this point. Thank you.
Thank you, Katie. And we are very lucky to have the finance team, but equally we're very lucky to have you as our Chief Finance Officer. Thank you. We'll then move on to the quality accounts, and Lucy, over to you.
Thank you, Chair, and good evening. So it's my job to present the quality account, which has been available on our public website and on the AGM pages for a period of time, given the account was not subject to auditing, as Katie alluded. It is a comprehensive document that includes all of our quality and safety work over the previous year. It includes our audit activity, progress against last year's quality priorities, and then it focuses on those things that we wish to prioritise for the forthcoming year. As part of our board reporting arrangements, we have a quality committee that's chaired by one of our non-exec directors. And at this committee, we continually ask ourselves, are we safe and how do we know it? What are our priorities and where do we want to improve? What are we proud of and what is new and different? Today's presentation is going to give a flavour of some of those things, yet the lion's share of the presentation is going to be delivered by Mr. Akhtar after my initial introduction. Next slide, please. So are we safe and how do we know it? We have a really strong incident reporting culture. In fact, we're one of the top trusts in NHS England, as can be seen by the graph at the bottom right hand of the chart, and we are the trust on the far left. So a really strong incident reporting culture. And we know that safety is underpinned by having a culture where incidents can be reported so that lessons can be learned. What's pleasing to note that our harm rate for patients is exceptionally low. During 2022, we introduced Safety in Sync, and this is an engagement forum that brings together NHS, social care, primary care colleagues, mental health colleagues. And this is where we discuss incidents, share lessons, and learn together to make improvements for the patients and the citizens that we serve. You heard the Chief Exec talk earlier about our improvements in relation to mortality, and we've moved from being a significant outlier across NHS England to having the lowest rates of mortality across our foundation group. And indeed, we're one of the top 10 trusts for mortality in relation to stroke. And we're also on track to deliver the national ambition for neonatal mortality. And finally, on safety, we have delivered all of the key milestones associated with the implementation of the National Patient Safety Strategy. Next slide, please. So what are our priorities? There are always things where we can make improvements, and this year we want to focus on the following 8 quality priorities. And I'm just going to touch on a few, if I may. Our patients tell us through a variety of feedback mechanisms, so family and friends tests, surveys, complaints, and the patient advice and liaison service, about those things where we could make improvements and we could do better. Feedback is really, really important to us, and what we really want to focus on this year is how we improve our communication with those patients and residents that we serve. We want to make sure all of our patients receive all the medication that they require on time, but in particular, we want to focus on those medications that are time critical, and we're focusing on pain relief, antibiotics, and we've signed up to the national campaign for Parkinson's medication called Get It On Time, and this will be a key focus. And we also want to focus on a number of assessments, ensuring we assess mental capacity, that we assess risks in relation to developing blood clots, VTE, pressure damage, and the risks associated with malnutrition or obesity. And by doing this, we can plan and improve care accordingly. And we certainly aspire to achieve exemplar status for VTE during the forthcoming 12 months. Next slide, please. What are we especially proud of? There are lots of examples, and here are just a few. The vaccination team across the integrated care system were commended at the Health Service Journal Awards and in the Parliamentary Awards for the delivery of the COVID-19 vaccination to the citizens of Herefordshire and the wider populations that we serve. The recruitment and retention team at Wye Valley were award winners at the Hereford Times Health and Social Care Awards for their innovation and transformative approach to the recruitment of healthcare support workers, and have significantly reduced vacancies and turnover for this staff group and providing career opportunities for our local residents and population. 2 of our senior nurses have been flying the flag for Queen's Nursing and have achieved leadership and membership roles due to their own successes in community nursing. And following the CQC inspection in October 2022, the inadequate ratings for safety and well-led within our surgical division were lifted, and that's a testament to the hard work of the clinical teams within the surgical division, but in particular. Next slide, please. One of our nurses has been elected to join the National Policy Development Group for the best practice in liver care. Our emergency departments have been working with the Autism Partnership Board to improve the experience of individuals with autism who are served and cared for in our emergency department. They've adopted Valerie's training, which increases awareness and recognition of autism. We're introducing the Autism Passport, and we've co-produced our approach by working with a group of school children and service users to make improvements in this. As the Chief Executive alluded to earlier, Wye Valley Trust International Nurse Recruitment has been recognised as an exemplar site. Our exam success rate for international nurse recruits is double the national average across the NHS, and we've recently been awarded the National Pastoral Award for the support provided to these valued members of staff. And for the last 2 years, Wye Valley Trust has been one of 4 trusts who've been working with the National Wound Care Strategy Programme on our lower leg wound service, which is delivered in the community to our patients. And we've seen a 36% improvement in healing rates for complex leg wounds, with healing being achieved within 14 weeks against a baseline of 23 weeks at the start of that programme. Next slide, please. I'm now going to hand over to Mr. Akhtar for what is new and different. Thank you.
That's great. Thank you, Lucy. Mahmood, it's great you're able to join us, and exciting developments in the field of robotic surgery at Wye Valley. Over to you.
Thank you very much, Mr. Chairman, and thanks everybody, and good evening. I'm Mr. Akhtar Mahmood. Can you hear me?
Yes, we can.
Sorry, I just got frozen for a second on the screen, so I said I better check it. Okay. So I'm here to present you a little insight into the new robotic surgery program at the Wye Valley NHS Trust, especially at the County Hereford Hospital. And very proud of our team who just managed financially, as well as executive teams who given us a go-ahead to implement the program. And also my theatre team, my surgeons, anesthetists, all very well adopted to the program, and it's now up and running. So I'll give you a little insight into that, why we are doing it, and where we are, and what we are looking for the future for the people of Herefordshire, and most likely with the ICB or ICS in the future partnership with our Worcestershire patient also. Next slide, please. So just giving you a little basic history of, most of us, we call it all the time robots or robotics. Did we ever look at what robot mean? Robot is basically, first time, it is a Czech writer who used the word robot as meaning a slave. It's the first time he mentioned it into his novel. And basically what happened, robot is a machine which is work with the instruction of a surgeon as a slave. So it's a master-slave relationship between the machine and the surgeon. So it's not that robot does the surgery itself, it's the master who's the surgeon who helps and direct the robot to do the surgery or utilizing it more effectively. The first procedure of the robotic surgery was actually directed towards the neurosurgery, where there is more tremor-free hands are needed, so the robot takes those tremor away. The first robot which was used was called Puma in 1975, quite a long time ago. But gradually, when it was adapted to the more surgical field, so 1997 saw the breakthrough when we did the first cholecystectomy, or removal of the gallbladder. Start of the millennium was the time when there was an explosion, and the Da Vinci or intuitive program was the first time introduced. I do remember the first time in London when it was used was 2002/3, when the first time a robotic surgery was done. So now, due to cheap instruments, as well as taking away or waiving off the patent of this system, there are many other competitors in the market, so the prices are go down, and we have now one at Hereford Hospital. Can we just move on to the next slide, please? So this is what I've just take a picture for just layman term point of view. There are 3 different parts of this system. One, which is see like a little arms on the background, is the patient cart which hold all the instruments which we insert through the little keyhole into the abdomen or any part of the body. Then there is a screen which projects it, and then there is a console where you see a gentleman sitting on the console like playing a video game, from where he controls the movement of the arms of the robot to perform the surgery. Next slide, please. So why do we use about this mechanism, this instrument or this machine for using? There is a many benefit. For me, when I was looking at it, I'm doing this surgery for the last 10 years, but at another trust. But when we looking at it, we are a very unique located hospital. And my main aim was for the retention of my staff, for the future recruitment of that. That was the main benefit. But alongside came other benefits which are for the patients. First of all, quality. It's improved the patient care. There's a better clinical outcome. There's a lower rate of post-operative complication. If I give you an example of one of the common operation which is performed is called the robotic prostatectomy, performed for the last 20 years now. When we used to do this open, the transfusion rate on patients was approximately 5%. Now, since the introduction of this system, it's 1 per 1,000 patient, or even less than that. So that's the way it is improving the outcome as well as the patient well-being. Reduction is the patient recovery time. We all know that minimal invasive surgery helps us the patient sent home. And since we have introduced here, I'm actually sending 50% of my patient after having their kidney removed go home next day. So this is a big achievement from 3 or 5 days after previous surgeries, now going home next day. Young man or old man doesn't make any difference. Less screening, scarring, and shorter recovery. The patients in the younger age group can go back to work more quickly. Significant less pain. The safety is another issue which we need to look at. It reduces the incidence of infection. As I said, lower rate of intraoperative blood loss. Reduction in the hernia formations, because if you have a big scar compared to a 7mm scar. Admission to ITU or high dependency unit. Similarly, improve the cancer outcome where it was the very first time used. But now we are trying to widen that net of the patients to use it for other common conditions also. For us, which I put the last one here in Hereford, we want to attract the medical workforce. The new surgeons, mostly trained on these instruments nowadays, would like to come to Hereford if we have a machine. So that's why, and thanks to all my team or executive as well as finance to consider that point very strongly. It helps a reduction in the waiting time list. It boosts the morale of our theatre staff, our working staff altogether. And also we will be thinking about doing some work in the future to make it more, bringing it into a private sector also. Can we go to the next slide, please? Next slide. Now, yes, thank you. The robotic surgery, when we were first informed, it was actually at the start of this year when NHS England has some money left over, some surplus, although we were trying to build our case for the last 18 months, but luckily we got a sudden approval in March this year. The machine arrived at the 30th of March on this site, and we immediately made up our implementation group, which was the various stakeholders come together, theatre staff, surgeons, the company introducing who is going to train the surgeons, and we decided how we are going to use it. We started the training in April, and I must say that we were the very fast learning group of surgeons as well as theatre staff. Within a month, most of the training was completed. We performed our first successful case of surgery via robotic on gynecology and some urology patient at the start of May this year. Since then, we have four different teams of 5 consultants who are going through the training. Some of them are already trained and started doing independently work. Theatre staffs are completely trained, signed off, and now looking after it. We have developed 2 groups of theatre staff who are going to look after these patients as well as the surgeons. We have a project manager, and again, thanks to my management team appointed or assigned to the cause, who is going to look after the different training at various levels and organize a clinical governance. Because the most important thing, when the new instrument come, everybody want to use it, but we want to use it in a manner or in a way that it is safe. So people should get training properly and to use it for their patients. Next slide, please. The expected number, we're just going to start in the surgery here group. Approximately, we are expecting 200 to 250 cases every year to be performed via robotic surgery. This is the number a machine can easily do in 1 year time, provided all the surgeons are trained, and we are on course actually. The surgeons training wise by the end of this year will be completed, and 2024 January will see more independent surgeons performing this surgery. You can see from the numbers we are implementing into a colorectal surgery where it will be used for the chronic cancers. Majority of them will be resected by this means. Gynecology, they're already started doing it, done a number of cases, and I'm very proud of them. They were the very fast and quick learner and very first group who were signed off, and their patients are going home next day. Urology, we are partially doing some of our work. We are still waiting to repatriate some work from other trusts gradually, and hopefully it will happen in the future. So our prostate patients will be benefited closer to home for these operations and in a timely manner, not waiting more longer than other patients. The future, I see it in the upper GI surgery, where the people with the hiatus hernia and things like that will also get benefit, and maybe a future to look at the bariatric surgery for them. What I see after giving you a brief description of this program, I have a vision that I want to expand that surgery, which is done robotically, not only here into our trust, but as Glenn said very clearly, our chairman, that we are in a foundation trust group. We want to have a robotic surgery academy comprising of various hospitals in the group, setting up a state-of-the-art type of a program for the future surgeons. Might take a couple of years, but it is possible. When I see that if we can have robot, we can certainly look into the future for the training of the new surgeons, new theatre staffs. It will help us to boost our retention as well as recruitment of the new staff. Hopefully, on the same forum, in a couple of years' time, I will be just presenting that we will have a fellowship program with the Royal College of Surgeons to train for the new future surgeons, definitely. So this is what my vision is, and I hope that executive, as they help me to achieve my vision by buying a robot, will help me to implement this program gradually across the Foundation Trust Group and taking it further. Thank you very much, Albert.
Mahmood, thank you very much. You've been absolutely at the forefront of this, and it is fantastic work. So thank you. And it's a win-win. It's a win for our patients. It's, after the initial period, a win for us in terms of productivity and quality outcomes. And it's a win in terms of retention and recruitment of surgeons who increasingly want to work in acute trusts that have a robotic capability. So thank you very much for the work you've done in terms of being a real advocate for our investment. Thank you. Okay, I think then we move on to the proposal to adopt the annual report and annual accounts for 2022 and 2023. I will propose those, and I'll do the annual report and accounts first. Can I ask Andrew Cotton to second those as Chair of Audit during that period?
Yep, I'm happy to second those.
Thank you very much. And for members of the Board of Directors, if you're not happy to adopt the annual report and accounts for 22-23, can you please raise a digital hand? Duly approved. Thank you. Then we move to the proposal to adopt the quality accounts for 22-23. Again, I'm happy to propose those and can ask Ian James, as current chair of the Quality and Assurance Committee, to second those, please.
Very happy to second those, Chair.
Thank you very much, Ian. And as to the whole Board of Directors, therefore, if you're not happy to adopt the quality accounts, could you please raise a digital hand? Okay, duly approved. Thank you all very much. There's been a phenomenal amount of work that's gone on into the production of those reports. So I do want to thank all of the team behind the scenes, John and many others who have been involved in pulling it all together. Thank you very much. So I think we then move on to questions from the public. And just a reminder for those members of the public who are watching this on the YouTube stream subsequently, you can still submit your questions after the AGM to Elke Herman, and there are details on that on the annual general meeting page. But the two questions we have received are from Dr. Ellie Chowns, the Green MP candidate for North Herefordshire. And her first question is, given that staff recruitment and retention is absolutely critical to effective operation of the NHS, what measures have been put in place to recruit, train and retain staff, especially local people, and especially in areas of shortage? And what data does the Trust have on the effectiveness of these measures? I'll pass over to Geoffrey Atuli, who will answer this for us. Geoffrey, over to you first, please.
Oh, thanks, Russell. Well, the Chief Exec, Glenn, covered some of that in his presentation when he talked about our Wye Valley pay and career progression framework for our staff. So we have in place a local development program where we support staff through things like apprenticeships. So on an annual basis, we have over 100 people undertaking apprenticeships, which is one way you can grow your own staff. So we also do a lot of work with officers from Job Centre Plus. So on an ongoing basis, we engage with them to try and offer recruitment opportunities and training programs for local people. We are engaging with a lot of local schools and colleges. So our recruitment team are always out and about, organizing local events with schools and colleges, and our employees also go out to act as Wye Valley ambassadors. So we go and reach out and just promote careers and promote different opportunities within the Trust. So we are actively trying to recruit local people. Over the last 12 months, we've also been working effectively with our partner, Halo. We ran a program called Together Healthcare, and the intention behind that was to recruit local people for the Trust. So in terms of support workers, healthcare support workers, 12 months ago, we had about 90 vacancies. Now we're down to about 10 vacancies. So we're actively out there trying to recruit and develop local people. At the board discussions earlier on, we talked about introducing a program, career development program, where we can develop more associate nursing staff and also more qualified nursing staff. So there's quite a lot of things we're doing within the hospital to try and engage with local organizations and local communities. In terms of the measures that we're seeing, I mean, so we now have the lowest vacancy rate within the Trust for the last 2-3 years. Our staff turnover is now down to about 11% from a high of about 16% a few years back. So there's still a lot more work for us to do, but I am confident that with the schemes that we have in place through apprenticeships and through our Wye Valley Career and Paid Development Framework, we are developing and supporting local people into the qualified vacancies that we have. I don't know if my colleague Lucy wants to add to that, Chair, because she may want to add a few more points on that.
You've covered that really comprehensively, Jeffrey. I don't think I've got anything to add.
Well done, Jeffrey, and a lot of those initiatives have had the impact they have since you joined us. So thank you very much for your endeavours. And the second question from Ellie was, what progress has been made with development and implementation of the Trust's sustainable travel plan? I could not find a copy of this on the website. Is it publicly available? What indications, baselines and targets is the Trust using for its sustainable travel plans? Alan Dawson, over to you.
Thanks. That's a timely question because we're actually developing our travel plan at the moment. It's being finalised. It's based on a survey of the sort of travel habits of our staff, and we are developing targets around that for the future. It's going through the approvals process in the Trust at the moment. It'll be published on the Trust website in the next few weeks.
Super, thank you, Alan. And Alan has been at the forefront of a number of our sustainability plans that Glenn indicated in his presentation, and we've done extraordinarily well for a relatively small acute trust to be at the absolute forefront of the energy sustainability and net zero push of the NHS. So well done, Alan and team, in that regard. Okay, so I don't think we have any other questions from members of the public at the moment. So we'll move on then to the recognition and achievements of our staff and volunteers. Hashtag amazing Wye Valley Trust staff. Jane Ives, our Managing Director, over to you.
Thank you, Russell. I'm going to pop on to the next slide, please. So it's my pleasure to do this section on recognising the achievements of our staff, but I was going to start with an email which I opened just a couple of hours ago, which was sent to me from our senior sister in endoscopy, and it came to her from one of her patients, and it said, yesterday, 4th of September, I had a colonoscopy at the endoscopy unit at Hereford Hospital. I wish I had the names of the staff who carried out the procedure and cared for me in the recovery room. They were kindness itself, as gentle as possible, distracting me when needed. As a retired nurse, it's a long time since I've seen such high quality nursing and care. So I think it's an absolute privilege that we have in the NHS to be able to look after our patients. And of course, not all of our staff look after patients directly, but all of our staff have a role in making sure that the care we give to our patients is the highest possible we possibly can. So as I say, absolutely my privilege is to, once a year, I get to publicly thank all of our staff. I say thank you all the time in lots of forums, but it's never enough. And it's a thank you to our staff, but also to our volunteers, also to our colleagues who work with Sodexo, and of course to our partners as well. So, so my first big thank you is, what am I saying thank you for? Well, I think I'm saying thank you to staff for your compassion and your kindness, both to your patients, but also to your colleagues. I think I'm saying thank you for your absolute hard work and commitment, but also for your enthusiasm and your willingness to take on new things, new practices, innovate, take on best practice. And the presentation we moved then was fantastic, you know, sort of really driving forward and doing things that are the highest quality we possibly can. So next slide, please. So we're always going to face challenges in the NHS, and last year was particularly a challenging one. And over the course of the year, we've recognised every month an individual or a team who works in our services. And the process for that is that anybody, so any member of staff, or indeed any patient, any member of the public, can nominate someone or a team for a Going the Extra Mile award, which is really what it says on the tin, someone who they feel has really, really done something extra special. And then there's a small committee of us who each month we sit and we look at all those nominations, and it's a really hard job because I have to come up with one. individual and one team who we'd select to be thanked publicly at the board that month. And so whilst this is a large list of people who've been the winners of those monthly awards, there are literally hundreds who were nominated and got a certificate and a thank you, and a member of the executive team went down and said thank you to them personally. But I think also what that list shows is that absolutely anybody in any role can make a difference, and it's nice to be able to recognise them. So one of the people on here is our admin apprentice in emergency medicine, so someone right at the beginning of her career in the NHS. And then we've got lots of very experienced nurses, AHPs, doctors, and specialist staff. So a huge well done, and thank you to all of our Going the Extra Mile monthly winners, but also to everybody who's been nominated, as I say, by a colleague or by a patient. So next slide, please. So Lucy's already touched on some of these. So the previous slide was all about the way that we thank and recognise staff within the organisation, and this is where our staff have been recognised either in a local award or a regional award, or some national awards as well, and some of those from the University of Worcester, who give out awards for mentors, and we've had some fantastic mentors who are training the next generation of our staff coming through. So again, absolutely fantastic work, fantastic to get that recognition, and a really well done to all of you. So next slide. But of course, it's always better that staff tell you themselves about all that brilliant work that they've been doing, all of the fantastic innovations and changes that they've made. So we've made a shortish video of some of those people who've been doing some of the work that you've been hearing about over the course of this annual general meeting. So if you're able to run the video.
So I arrived in Hereford about a year ago, and when I arrived there was quite a backlog after the COVID pandemic, so there were long wait times for echocardiograms. Now echocardiograms are really important to get patients diagnoses that can then impact what treatment they need to help their health, so it's very important for us to address this. It's a very useful investigation because it helps us find out if a heart is structurally normal. It lets us know if the pump function is normal or whether it's not pumping appropriately, which we'd call heart failure, and it lets us know what's going on with the heart valves to ensure that they're working correctly and they're not leaky or too narrowed. The reason it was so important for us to make the echo wait time shorter is because we want patients to get their investigations in as timely a manner as possible, which allows us to get the diagnosis they need so that appropriate treatment can be started. We've approached this in several different ways. One is that the management have been really supportive in getting locum support in, so we could start scanning on days of the week that we didn't normally scan on to work through the backlog. Another way is that we started to triage our echoes more aggressively to make sure that people who needed urgent echoes would get them in the most timely manner possible. And we've also started to invest in training more echocardiographers to help make the service more sustainable going forward.
We devised a plan along with the cardiology management team, whereby we would work a 7-day week for a period of 8 months. All of the echo team did extra slots and extra patients, and we also brought in an external company.
Another benefit of patients having a shorter wait until they have their scans is that by getting earlier diagnoses, we hope to implement treatment earlier, which will hopefully decrease hospital admissions long term.
We've also invested in an echo simulator, and this enables us to train other members of staff from areas across the trust without inconveniencing a patient. It means that we can enhance and develop our training of other staff to perform basic echocardiography. Altogether, this is leading to us being able to scan over 600 patients a month now.
We get lots of referrals from our GP colleagues when they have concerns about the function of their patients' hearts. We've done some education sessions to help ensure that we get the information that we need to help ensure that the patients that need scans most urgently get them in that timely manner. And there's been positive feedback from our GP colleagues over how the waiting time has improved. We've also upskilled our reception staff to help with triaging to make sure that the patients that need the scans most urgently get them in the most timely manner possible. One of the really exciting things going forward is our plan to upskill and train some of our colleagues in the emergency medical team and the acute medical team to be able to deliver focused bedside echoes to a level 1 BSE standard, which will take some of the pressure off the outpatient echocardiography service and allow inpatients to get some of their diagnoses in a more rapid manner.
It was a challenging time, but it was very rewarding ultimately when you see the waiting list start to come down and you hear from the patients how grateful they are to have received their investigation so that they can move on with their treatment.
I would like to thank the entire echocardiography team because it has very much been a team effort to overcome this waiting list. So our reception and bookings team, our echocardiographers, our fantastic lead Claire Seal, and also the cardiology managers who help with finding resources to help this be achieved.
Healthcare support workers are the key entry point into the NHS. They are at the heart of our patient care delivery and are key valued members of staff. We are aware that our vacancy gaps were high across the Trust, so we introduced a centralised healthcare support worker recruitment team. That team consists of a healthcare support worker project lead, a healthcare support worker recruitment assistant, along with a healthcare support worker practice educator facilitator.
I came into the project a little way in. What we do now is we're with them every step of the way. We start with their training at the very beginning. They see me and my colleagues in the classroom, and then we follow that up through into the clinical areas. We're there for them at any time that they need us. And I suppose having that familiar face and knowing that there's somebody you can come to makes a huge difference, which is shown in the retention.
We're working in partnership with Hoople Care to bring together our resources to double up our efforts to recruit healthcare support workers across Herefordshire. The team works together to ensure that we provide the best outcomes for our healthcare support workers in their positions at the NHS.
We're offering solid training, quite a comprehensive training programme. We include the care certificate if people haven't already got it, and clinical observations. So the care certificate covers the fundamentals of care, and that's things that you would assume that would be easy to do for somebody else because you do them on yourself, like cleaning your teeth or having a wash or helping somebody go to the toilet. But there's lots of other things that you need to take into consideration when you're doing that for somebody else. And then there's the other end of the spectrum. We are an acute hospital. We have acutely unwell patients, and we need to make sure that any deterioration in that patient is being recognised early, and we do that through taking clinical observations and teaching them how to escalate and communicate to other team members in an urgent yet appropriate manner so that the message gets through, so the help can get to the patients.
We secured funding from NHS England to support with the programme. We've maximised opportunities to attract local staff via social media routes, recruitment campaigns, marketing companies also.
We're trying to prioritise or get people in that are new to care as well, so we're kind of growing our own staff. So it's about preparing them and then keeping them going and helping them progress through a career ladder as well if they want to.
We introduced a career progression pathway, which means healthcare support workers can develop through to senior healthcare support workers, right through to registered nurse degree apprenticeships. We've had targeted recruitment events that we've facilitated with open days, local market stalls, promoting at local colleges. We're also working in partnership with the local job centre to maximise opportunities across the NHS. The vacancy gap so far has reduced significantly, which has had a positive impact on the care that we deliver to our patients. We'd like to thank the clinical teams for their support with the centralised recruitment approach to healthcare support workers. I'd also like to thank everyone within the human resources and education teams for their continued dedication and communication throughout the programme.
I would like to thank all of the team members in the education and development team, and actually in recruitment as well, because we all work together very hard to maintain this momentum.
WALANT stands for Wide Awake Local Anesthesia No Tourniquet. This is a service which is safe, efficient and cost-effective. Well, many patients with wrist, hand and some elbow surgical conditions can be treated safely outside the theatre complex and in an outpatient, more relaxed setting with great patient satisfaction and experience. When we apply a tourniquet normally to a limb, it causes discomfort and pain, especially when the procedure lasts more than 10 minutes. With WALANT surgery, we introduce a calculated mixture of local anesthesia and adrenaline, and this would eliminate the need for the use of the tourniquet, and allow us to expand the range of hand and wrist conditions that can be treated in this way with much better patient satisfaction and experience. WALANT service has endless benefits to patients, staff, hospital and trust, as well as the environment. Also, patients who are not suitable to have general anesthesia due to medical complexity can have their operation through the WALANT service safely. And another benefit to patients is that not only that they don't need to fast before this procedure or stop any of their medications, including blood thinners, but also because they're awake and responsive, we can use this time of surgery to educate the patients about how they look after their wounds, how they look after their limb after surgery, give them information about the aftercare, removal of sutures. The patients feel more relaxed, more engaged, and very satisfied from the feedback that we get. They get to stay in the hospital for less time, and even their recovery is much quicker. We're freeing up theatre space, we're freeing up bed space. We're needing less staff, where we have 4 members of a team running this service compared to previously having 8 in main theatres. Expanding this service was fantastic because we managed to gather more people around, and the staff have found it very satisfying as they get endless compliments from patients that going through the WALANT service. They get the opportunity of training and expanding their professional skills at the time of working in this service, which gives them great job satisfaction and increase their morale. The WALANT produce less than quarter the waste that is generated in the main theatre for a similar case. This service has been also nationally recognised in our trust through the NHS England Get It Right First Time programme, which is designed to improve patient care and patient journeys. Waiting time have been reduced after the introduction of WALANT service, and we're expanding this service even more by training more staff. I would like to thank my fantastic and WALANT team for this superb patient care that they're providing. I would like also to thank the outpatient sisters and outpatient theatre sisters as well for providing training and quality assurance outside the theatre environment.
At the outset of the pandemic, I was tasked with setting up an early supportive discharge team to help support respiratory patients and those with COVID to be discharged from hospital early. We were one of the first trusts to set up an early supportive discharge team. We know that patients recover more quickly at home. They have less chance of getting hospital-acquired infections, and psychologically it's better for them. The multidisciplinary team includes the respiratory consultants, specialist nurses, allied health professionals and assistants assess the patients on the ward and deem that they are suitable to join the early supported discharge service. Specialist nurses then prepare the patients for discharge and ready for their calls when they leave hospital. So this includes patients with short and long-term respiratory conditions, including COVID-19, where the recovery is really unknown for some patients. And I think the ongoing support of daily phone calls, reassurance has really benefited those patients. Prior to discharge from hospital, patients are provided with information pack, a pulse oximeter, which measures patients' oxygen saturations. Their inhaler technique is checked, and any oxygen equipment which they may require on discharge is discussed, and they're advised how to use that. The patients are phoned consecutively for 7 days.
Hi, it's Elisa calling from the early supported discharge team in Hereford Hospital. I was just calling today just to see how you are and just to ask you a few questions, if that's okay.
Then after 4 days, and then after 10 days, and if they are deemed stable, then a discharge from the service. During the telephone calls, they are assessed for their need for community physiotherapy or district nurses, and referrals to those teams are completed if required. Patient feedback is extremely positive. The fact that they have the support, reassurance and comfort of knowing that they're having a daily phone call when they leave hospital it has been really beneficial. We've had about 750 patients through the service currently, and all the feedback has said very similar. Setting up the service, I think, within such a short time frame and having the support of Wye Valley and external resources has just shown that even at the most challenging times, it is possible, and that patient care is high on everybody's agenda. We'd like to thank the whole respiratory team that have supported discharge service, especially the 4 assistants that carry out the phone calls on a daily basis and provide the support and do it in a very empathetic way.
We have a national shortage of registered nurses in the UK, and we have the hard to fill gaps, especially in the nursing workforce here. We have to ensure we maintain a nursing workforce for our patients, for their safety and their care across the county here at Herefordshire. And it's important that the team do what we want them to do, because that maintains our service. We actually recruit our nurses from overseas. We work with our recruitment agencies that source and vet the nurses and screen them before arrival.
Before our nurses arrive here in the UK, they have already completed their language competence assessment and their computer-based theory test, which demonstrates their competence within the nursing profession. Once they've arrived, they then have to complete a training programme with us that will support them onto to go on to pass the final part of the registration process, known as the objective structured clinical examination.
We make sure that every nurse who arrives is well looked after, is actually met upon arrival. We have like a 3-prong effect. We have pre-arrival, arrival and post-arrival. So on the pre-arrival, pastoral officers will actually engage with the nurses that are due to come over, and they'll have a Teams call, because obviously they live in different parts of the world, and we will actually talk to them and say, you know, this is the process, we'll meet you and greet you on arrival. And then we have the arrival, where we actually take care of them, we take them to the banks, we look after their welfare, we actually involve them in transition stage to actually meet other staff in the trust from different cultures and nationalities, and we also support their families coming over as well. And then post-arrival, we have to really make sure that they are settled in well, that they can take their OSCE examination and become a registered nurse in the trust.
Many of our nurses that arrive into the UK are often really experienced nurses with massive backgrounds in healthcare within nursing. They've often had managerial roles in their previous experiences within the nursing profession. We have delivered a programme of training to our new international nurses through a classroom-based approach using blended learning. So we've used some role play, we do simulation, We do question and answers, presentations, just to support our international nurses into the programme to enable them to successfully pass their exam.
It's a team effort. It's comes from obviously the exec sponsor, which is our Chief Nursing Officer. And from that, it's the clinical and the nursing teams, it's the educational teams, the practice facilitators who do the OSCE preparation and training, our recruitment team and our pastoral team.
I think it's about recognising that it's an overall accomplishment within the trust, but especially the clinical managers and the staff that support them out in practice, because that transition is really felt on the ward level. And it wouldn't be possible if they didn't have that positive experience.
In the last 3 to 4 years, we've recruited over more 300 nurses from various countries across the globe, and the retention has been really good here. They tend to bring all the families, which is great because they settle. The children attend local schools and colleges and nurses as well. We've been recognised as a best practice model on NHS Employers website, and we've also been praised by the CQC for our great work we do here.
We've had many nurses go on to become senior nurses within their wards, moving around the trust within the organisation to get the senior positions. And it's really lovely that they're able to role model then to our new arrivals that they've got them aspirations going forward.
I feel very proud, privileged to have made a difference to these nurses' lives, not just myself, but my team. They work really hard. I'm proud of their efforts and their dedication. And we also go the extra mile. We go extra 1,000 miles really to make sure that they're safe and that they've arrived here. I'd like to thank everyone involved. It's not just one person, it's not just two, it's everyone. It's from the taxi driver that picks them up from the airport to the clinical nurse on the ward, to the practice education team, to the recruitment team. And we are all passionate about, making sure that they have a safe journey as well. It's also a dream that these nurses have from India and the Philippines and Middle East that we bring them from, and their dream is to live and work in the UK to actually support their families back home. I'd like to thank our international nurses for making that long journey and also for leaving families behind, because I know it's not easy to leave children behind and partners and husbands and wives. So I'd just like to say a really big thank you to them for their continued professional care that they give to our patients in Hereford.
Hi, I'm working in the pediatric department. First of all, I have to say I'm very happy to be working in this organization, and I am so happy that I could come here in UK and work here. Previous my experience was in pediatrics, so I got here in pediatric only. So I love kids. I enjoy working here. There is no stress. I'm so happy here to work, especially in the pediatrics ward. Thank you so much.
Is that it, Jane? Thank you. Well, a whole series of fantastic short videos there demonstrating just some of the fantastic things that have been going on in the trust. So really delighted to see that staff recognition video. And we now move on to what for me is one of the most enjoyable aspects of the annual general meeting, when I award the Chairman's Award. And I just want to say a few words about this year's award winner. So Kath Holbury, who's on the line with us today, joined the NHS on the 3rd of June 1985. Must seem like only yesterday, Kath. Starting as a student nurse with what was then the Herefordshire Health Authority. She's worked as a nurse in almost every aspect of Herefordshire's NHS in a variety of settings, most notably as a sister, lead nurse and matron in older people's services. On the 1st of September 2010, Kath's interest, experience and commitment to professional nursing found a natural home in the adult safeguarding area, where she worked until her retirement in June this year. The name Kath Holbury has become synonymous with adult safeguarding at Wye Valley. If you're concerned about adult safeguarding in any way, everyone's told, speak to Kath. Kath has been, and I've seen this in the meetings she's had with us as a board, a tenacious advocate for our most vulnerable patients and their families, providing expert advice and guidance whenever required. Her expertise regarding safeguarding matters has been shared not only with our own staff, but also the wider team in the Herefordshire Adult Safeguarding Board, with external partners such as the local authority and police service. Kath has made a remarkable contribution to patient care in Herefordshire for the last 38 years, for which we are tremendously grateful. And she leaves behind a legacy of a well-developed team to continue to embed her values and advocate for some of the most vulnerable patients we have. Kath, on behalf of the whole of Herefordshire, I can't thank you enough. You're an absolutely worthy winner of this year's Chairman's Award. Thank you.
Thank you, Chair.
No, thank you, Kath, and enjoy your retirement. We hope you pop back and see us soon. And we know your mum's not been very well, and so we hope she gets better as well as she can be as soon as possible. I just want to close this annual general meeting with a few other words of thanks. I'm immensely grateful to all of the executive directors at Wye Valley. You do a phenomenal job day in, day out, particularly Jane Ives. Jane, you're an inspiration. You're tenacious, you're relentless. As an ex-nurse, you know the NHS in so many different ways, and without you, we would not be achieving the success we are. I also want to thank all of my non-executive colleagues, those who have served for many years. Frank Myers, who's on the call, I think is the longest serving NHS NED in the country. So particular shout out to Frank, but also those who have been chair of the audit committee, which is now Nicola Twigg, previously Andrew Cottam, the chairs of the quality assurance committee, I mentioned Ian James earlier, and Francis Martin, who's going to take over as the vice chair after Andrew's retirement. Thank you all very, very much for your hard work. We have still much to do as a trust, but I'm absolutely sure with the people that we have, led by Glenn Burley, our chief executive, and the addition of Worcester Acute into the foundation group, we will go from strength to strength. We're facing a number of headwinds, as our frontline staff know at the moment, with increased demand, real capacity issues, the various different strikes that have occurred. But I'm optimistic that we as a team will be agile and find ways through it. To citizens who are watching on YouTube, there will be another AGM next year, date to be arranged, but around this time. But in the meantime, if you've got any questions on anything, don't hesitate to reach out to us. And we as a board do meet every month, so you can always keep an eye on us in between the AGMs. Thank you very much, everyone. Take care. Bye-bye.